Hi, my name is Nurmai Sarah binti Shuhaimi. In this video, I'm going to present my clinical case study with the title of Ultrasound. I was given a clinical case scenario and I need to explain the procedure as well as give clinical reasoning in order to answer the question given. A 55-year-old man was referred for ultrasound examination because of chest pain, breathlessness, and headache. This patient had uncontrolled systemic arterial hypertension for 15 years and had been treated with beta blockers, diuretic and angiotensin receptor blockers, and calcium channel blockers. Despite this therapy, on physical examination, his blood pressure was 185 per 120 mm of mercury, with no difference between the two arms. He had no history of diabetes, but he was a smoker. Laboratory test results were blood urea nitrogen band 32 mg of deciliter, creatinine of 1.0 mg per deciliter. Creatinine clearance was calculated at 75 ml per min, potassium 5.4 milliequivalent per liter, sodium 133 milliequivalent per liter, and chloride 99 milliequivalent per liter. His heart rate was 88 beats per minute. Chest radiographic result demonstrated an enlargement of the cardiac silhouette and enlarged hilar vessel. Are commonly used to lower the high blood pressure. The uncontrolled systemic arterial hypertension or systemic hypertension can be defined as a high blood pressure in the arteries which is caused by the constriction of the arteries. Therefore, it increases heart workload and raises arterial pressure. This situation may lead to the possible signs and symptoms of this patient, which are chest pain and breathlessness. The causes of systemic hypertension may also due to a narrowing of aorta, kidney disease that involve a narrowing or stenosis of the renal artery, and certain endocrine disorders such as Cushing's disease. However, the medication that he depends on also may give the side effects such as hyperkalemia, where as a high content of potassium in the blood, it may give an abnormal result in the blood test. The side effect is related to angiotensin receptor blocker uptake. However, these three types of medication can also cause the side effect of headache, which is the sign and symptom for this patient. If we focus on the laboratory test, all the components are in abnormal range except the creatinine level and chloride. However, we need to remember that creatinine level is the most related to the creatinine clearance. Unfortunately, the creatinine clearance for this patient is abnormal while the chloride is normal. Interestingly, it makes sense that the amount of chloride in the blood is related to the presence of diabetes. For this patient, his chloride level is normal and he has no history of diabetes. Okay, now let's focus on the previous radiological investigation, which is chest X-ray result. It shows an enlargement of cardiac silhouette and enlarged hilar vessels. This enlargement of cardiac silhouette is commonly related to the cardiac thoracic ratio (CTR), with the result more than 50%. It is commonly due to congenital condition, high blood pressure, coronary artery disease (CAD), and kidney disease. Meanwhile, enlarged hilar vessel is commonly caused by pulmonary arterial or venous hypertension, increased pulmonary blood flow, or lymphadenopathy tumors.